Developing right now at 6, an FDA panel recommends authorization of the Pfizer COVID-19 vaccine.
It's a major hurdle cleared on the way to what could be a historic vaccine rollout right here in the U.S.
And we have team coverage on this developing story, and we begin with Alex Finney from the latest from the FDA.
Well, Nicole, as well as Louis, that vote just coming down, the committee voting 17-4, forging ahead with the Pfizer vaccine. Now, it is worth noting this is a step. Now we wait for the final okay from the FDA. This, of course, is a major moment in the fight against COVID-19. Today, we're hearing from those who participated in the clinical trial, such as Evan Fine.
The question that everyone asks me is, well, what happened in the long term? Are there any long-term side effects? And it's been more than 5 months now since my first shot, and I can happily report that there are none.
Crucial vaccine kits now being sent all over the country. 2.9 million doses of the Pfizer vaccine will be sent out within just 24 hours of authorization. Minor side effects such as fatigue, headaches, and chills were noted during discussion today. The committee noting there are issues that need to be addressed.
We're already facing significant levels of vaccine hesitancy, and if patients are not forewarned about these adverse events, the word will surely spread rapidly, potentially exacerbating the hesitancy problem.
Analysis done by the FDA found the vaccine to be 95% effective.
The American public demands and deserves a rigorous, comprehensive, and independent review of the data.
Also discussed what risk this vaccine poses for pregnant women. All right, and Doran Fink said during the meeting today, Doran Fink Doran Fink said during that meeting today that the risks when it comes to pregnant women still not known at this time. Of course, we are still waiting for that final okay from the FDA. Doran Fink there over at the FDA as well. As soon as we do get that, we know that's expected to come in the coming days. We, of course, will let you know. For now, sending it back to you, Nicole.
All right, we are one step closer. Thank you, Alex. And tonight we're learning that when approved, not everyone will jump at the chance to get the vaccine.
And for that, let's get to Amy Viteri. She continues our live team coverage. Amy?
Well, it has really been a mixed bag when you talk to people about how they feel about actually taking or getting that vaccine. Less than half of the people surveyed at Jackson Health System said they will take this first dose as it becomes available. But when you visit nursing homes, you get a different story. It seems they cannot wait to have the opportunity to get vaccinated. As the country watches and waits to see what happens next with the first of several COVID-19 vaccines, those at the top of the priority list are split on whether they want it.
Feedback we're getting from our residents has been overwhelmingly positive on the vaccine.
Last week, in a survey of Jackson Health employees asking whether they would receive the vaccine once available, just under 50% said they would. Around 35% said not yet, but they would consider taking it in the future. Almost 15% said they were not interested at all. This as officials in Washington urge people the risks of getting the virus outweigh any potential risks of a vaccine.
Our advice to everyone, on a volunteer basis, our advice to everyone is to take the vaccine just based on risk.
That advice seemingly resonating with some of the nursing homes we visited in Hialeah, the other group at the front of the line for the vaccine.
They've been waiting for it.
Roy Oro says the pandemic has been especially hard on residents at his facility, Garden Walk Assisted Living, many already dealing with mental health issues.
Can you imagine being locked up for the last 7 months of your life and not really understanding what's going on?
He says overwhelmingly they tell him they want the vaccine, and for the most part, staff seems open to it as well.
In one. Main thing is like they're excited to move back out and go on with their lives.
And around half of Jackson Health System employees actually participated in that survey. So we're talking about 5,900 people who were surveyed, but a spokesperson says any eligible employee who wants to take the vaccine on this first phase will be able to do so. They have been assured that they are getting enough to cover everyone who wants the vaccine. We are live at Jackson Memorial Hospital tonight. I'm Amy Viteri, Local 10 News.
And it looks like we're on the precipice of that happening very soon. Thank you, Amy.